Well, let's talk now to Vicky Shanks, whose daughter Pippa has anorexia and autism. Dr. James Cusack, who is Director of Science at Autistica, and also with us Dr. Andrea Brown, a consultant psychiatrist at an NHS specialist eating disorder service called the Shern Clinic in York. Welcome all of you. Thank you so much for talking to us. Let's talk about your daughter Vicky. How did she develop issues around her eating?
That's a complex question. I think anyone on the spectrum have tendencies towards sensory issues, and a lot of those sensory issues can be based around food, and certainly with Pippa they were. But her father committed suicide when she was 6, and she was 4 stone when he died, and she decided very rigidly that she wanted to remain 4 stone because she felt closer to him if she did. So I think with Pippa there were a lot of factors. There was a lot of trauma involved. There were the sensory issues around food. There was the rigidity of thought and the rituals around food that a lot of people on the spectrum, not just about food but about anything, can develop a lot of rituals. And I think if you combine all of those, you've got almost the perfect storm for someone to develop another disorder, whether it's an eating disorder or something else. So all of those factors came together.
Understood. But it was not about losing weight.
No, not specifically. Because we've had this discussion so many times, and I think people have this perception that if you're anorexic, it's because you have some kind of body dysmorphia and you look in the mirror and see you're fat when actually you're not. And there are very few, in my experience, who actually that is the case. With Pippa, it was certainly more about, as the lady on the VT said, it's more about the obsession about counting calories. She would scan a piece of chewing gum every time she ate it to check it was still 1 calorie. And the exercise that she started to do, she'd be very specific about how long and how many steps and what she was doing.
So it's about adhering to rules.
Yes, it's much more about adhering to rules.
Absolutely. And things got very serious. I mean, she's had 2 spells in inpatient units, hasn't she?
Yes, 2 long spells. She was in for 5 months the first time, just after her 14th birthday, and then they got her to her goal weight, which was the criteria for being discharged, and then she was discharged, came home, and a few months later her weight had dropped again to the point where she was readmitted, and she was in for 18 months on that occasion. And her liver was shutting down, her kidneys weren't functioning properly, and you know, there was a real danger of her starving herself to death, and she had to be tube fed for a long time.
And what impact did that have on her?
Awful. I mean, it's horrific, and also the shame that goes with it. You know, she was so ashamed of her problems, and she didn't really want us to know, but of course we had to know because we had to be part of trying to help her. But it's very difficult, I think, to do anything around something which is such an integral part of life, which is eating. So if someone's addicted to alcohol, you can put them in rehab and you can remove the alcohol from the situation. When it's an eating disorder, you can't remove someone from food. It's impossible, they have to eat. So it's a very difficult obsession to actually do something concrete about.
James, do we know why there might be a link between autism and anorexia?
I think there's a few possible reasons, but really we need more research. And if we were to look at the possible reasons, they could be biological. So it could be that there's a biological basis of autism and anorexia which is shared, which could explain the differences. We also know that people who are autistic experience quite a lot of adverse experiences, difficult events, which could lead to anorexia onsetting. And then also we know that there are things about autism which are in common with things with anorexia. So a focus on routine, for example, specific sensory interests, and those are the sorts of things which could easily lead to things like anorexia. But we really need to know more about what the risks are and why anorexia onsets in autism.
You want the NICE guidelines, which inform the best clinical practice in the NHS, to be altered so that they include a reference on autism in the section on eating disorders. Why and what difference do you think that would make?
I think we need better recognition of autism in people who have eating disorders. Unfortunately, we know that people who are autistic experience even more adverse outcomes in people who just have an eating disorder. We know that treatment isn't currently optimised for them, that if we knew that someone was autistic, we could adapt services so that they're more autism enabling and more autism friendly, so ensuring that things are communicated more clearly, ensuring that people's sensory needs are met, ensuring that things are a little bit more predictable and easy for people on the spectrum. And I think it really serves everyone if you know about the autism diagnosis.
Yeah. Would you agree with that, Dr. Andrea Brown?
Definitely, yes. I mean, there's two issues really. First of all, I'm speaking from a clinical perspective. Some patients come to us with a diagnosis of autism already, but there's also a cohort who come to us and who don't have a diagnosis, or maybe have a different diagnosis or have been misdiagnosed. And that is a big issue really. So the first thing we need to establish is whether or not the person is on the autistic spectrum.
What do you do differently in your clinic for women with autism and anorexia?
Well, first of all, I think it's really important to say that a person with autism and an eating disorder will be very different. Everybody has unique needs. So the first thing that we need to do is to get a very good understanding of their individual difficulties, and then you can tailor the treatment to the individual person.
And do you agree that the NHS, that the NICE guidelines should include this reference to autism in the section on eating disorders? Would that help?
I think so, because I think we're very aware of autism and have a great interest in helping people, but I don't think that's necessarily a universal thing. So when you look at the NICE guidelines, they do actually refer to other comorbidities that may coexist with anorexia and other eating disorders, but they don't mention autism. And I think just having that mention would at least make people be a bit more aware and maybe think about it a bit more.
Yeah. I mean, NICE say there's not enough evidence, James Cusack. There's not enough evidence to yet do that. What do you say to that?
Well, I think when you look at the experiences of researchers who are experts in the field, there's a lot of peer-reviewed research which is emerging, which really shows that, you know, as many as 1 in 5 people with an eating disorder are autistic. And that's, you know, objective peer-reviewed research. You're looking at the experiences of people who have that lived experience. You're looking at experiences of clinicians.
Right, so you're saying the evidence is there.
There's an overwhelming
There's no
evidence.
need to delay.
There's consensus. There's a need to do this to ensure that we're adapting services, and there's a need for really NICE to recommend further research into this area, because if we don't do that, we're not going to improve the outcomes of, you know, some of the most, you know, disenfranchised people in society.
Let me read some messages. Sharon says, my daughter has autism and has always had eating problems, food avoiding due to sensory issues. Yeah. Tanya says, my daughter was diagnosed with autism at 6, she's now 18. Treatment helped, but she was frustrated by being told at sessions that autism is not an eating disorder. Everything seemed to be compartmentalised. So I would say, yes, treatment needs to be autism specific. Daniel tweets, ever since my huge weight loss, I'm obsessed with counting calories and probably don't eat anywhere near as much as I should. My GP used to tell me to eat much less, and now he says to eat much more. Becky says it has to be acted on. Anorexia has been the hardest battle for my family with respect to mental health conditions. The road to recovery is long, slow and undulating. It's considered by some to be a condition of vanity. I can assure you it isn't. And Elizabeth finally texts this, after trying for 10 years to get my 20-year-old daughter diagnosed for autism. She had it confirmed a fortnight ago. One of her issues is not liking food, but luckily she understands that she must eat, but I have to make sure that she does. Thank you, all of you, very much. Thanks for coming on the programme. Thank you. Thanks, Andrea, for joining us in York as well. Thank you.